Welcome back. It's important for all of us to keep moving and stay healthy and active during this pandemic especially, but sometimes aches and pains can keep us from reaching our fitness goals.
Yeah, working from home and even some simple household activities can all create problems for your body. One solution, seeking help from a physical therapist. Joining us live this morning is Brian Blevins, Senior Clinic Director with Stride Strong Physical Therapy. Good morning, Brian.
Good morning. How are you guys?
Doing well. How about yourself?
Excellent, excellent. Nice Monday morning in October in Oregon,
Right. Okay. So yeah, let's kick this off here. It's Monday. We're getting motivated. I'm curious. This has to be kind of a different time for you guys. Are you seeing different types of injuries coming in to physical therapy right now with people working from home?
Yes. I mean, these injuries happen all year, no matter if it's a pandemic or not. But we definitely see a lot of work-related injuries from having to work from home. So, people don't have their normal work setup that they would at the office. So now instead of having one workstation, they have 10. They go to their kitchen table, then to their couch, then to their bed, whatever it may be. And we're seeing some neck injuries from poor posture, some back injuries from improper sitting arrangements and things like that. So we're seeing definitely a myriad of different injuries across the spectrum.
Yeah, all that time in front of screens it can be really tough on you. So, how can a therapist help someone get back into a fitness routine?
Well, that's a great question. So we'd have you come in, and of course, if you're not comfortable with that, a lot of therapists are doing telehealth now. But we can do an evaluation like we normally do, and we can find out, joint limitations, range of motion, strength issues, these limitations that are putting you at risk for higher injury.
How has the physical therapy process kind of changed during COVID? You mentioned a lot of therapists doing telehealth now. Have the treatment protocols and any of that changed too?
Treatment protocols haven't changed a lot. Of course, we're screening people as they come in, checking temperatures, asking questions where they've been, of course, the standard. But we're trying to limit how much manual therapy we're doing. Of course, we all wear masks and try to maintain social distance as best as we can while benefiting the patient as much as we can.
Yeah, you mentioned that you're doing a lot of the telehealth, the teledoc appointments. Is physical therapy, I mean, can it be as effective during doing that? How do you help people through a screen, I guess, work on these
Yes.
problems that maybe they got from a screen, from working on a
Right.
screen?
Exactly. Yeah. So, according to the research, most benefits of physical therapy come with active therapy. So, exercise, stretching, things that you can do on your own. That's why we give you a home exercise program. So we can easily go through those via telehealth. It does help. A lot of our job is actually putting our hands on you and being able to feel things, and your body tells us just as much as your words do sometimes. So telehealth, although it's effective, is not always as effective as it can be in person.
So I'm curious, I think a lot of people probably think, oh, physical therapy, that would be like after a car accident or when I get really hurt. Like, what are some of the signs or symptoms for people that would let them know, no, this is something you probably want to go see a physical therapist for?
Yes, that's a fantastic question. So yeah, people view physical therapy a lot as reactionary. We're one of the only healthcare professionals that can actually treat you before you get injured, because we don't necessarily treat injuries. We treat the things that cause injuries. So if people have little aches and pains, I get it all the time where people come in and they say, I've had back pain for 10 years. Well, you didn't have to, so we can really look into that, evaluate these causes, and hopefully give you some tools to be able to help yourself.
Yeah, because it doesn't always just go away.
Oh,
You can't just
no.
walk it off.
No, yeah. It's a Stride
Yeah.
Strong Physical Therapy. You guys have 2 locations?
2 locations right now. Yep. One in Hillsboro and then one in Cedar Mill.
Okay,
Very
cool.
cool. Okay, Brian, thanks so much for joining us this morning. And for anyone
Of
out there who
course.
wants to try some physical therapy to stay on track in quarantine, we'll have a link to Stride Strong and their locations at KOIN.com. Have a good one.
Excellent. Yeah. Thank you guys.